Today, I will be getting the vital signs of my patient. But before that, check the chart and the doctor's order for the client's name, frequency, and the baseline data. Checking the patient's name and chart for the latest order for the temperature and frequency to ensure that the procedure to be done is right. Prepare all the equipment and bring to the bedside to save time and energy and enjoying the procedure. Wash the hands and observe. Identify client and explain the procedure to ensure the right client and let the nurse elicit cooperation of the client. Hi ma'am, good morning. I am Arian May Montanya and I will be your nurse for today. Karon kay kuhaan ti ka og vital signs pero ang una na kuhaon sa imo kay ang imong axillary temperature. Okay lang sa imo ha?
Okay, sure.
Sige. Mangutan ako ma'am sa pangalan.
Ay, ako di ay si April Grace Dinke.
Kano sa imong birthday?
March 21, 2001.
Okay, thank you for that. Provide for the client privacy. Provides a secure environment to the client where they receive a medical care. Wipe the digital thermometer from the bulb towards the stem with the alcoholized cotton ball, then wipe it with the dry cotton ball in twisting motion. By wiping the digital thermometer in twisting motion from the cleanest to the dirtiest, ensure the contact with the entire thermometer, thereby minimizing the spread of microorganisms for the cleaner area. Pat dry the client's axilla using the tissue paper or washcloth. Pat drying the client's axilla could cause inaccurate reading. Ma'am kanang trapohan na to imong kuan ma'am kanang axilla kanang ako imo trapo or ikaw lang?
Ay, ako lang.
Sige. Turn on the thermometer on and check for the LCD screen display and ready to use. To check the functionality of the digital thermometer before placing it to the axilla. Place the thermometer on the client's opposite side directed upward and place arm across the chest to secure the thermometer in place. Ma'am, ibutang na ako ang thermometer, ma'am.
Okay, sure.
Leave the thermometer in place until it will emit a sound, meaning result is ready. Allow the based on the manufacturer's instruction and recommendation to reach a maximum temperature reading. Remove thermometer, wipe it using a dry tissue paper starting from the stem to bulb. Ma'am, tanggalon na nako.
Okay, sure.
Ma'am, ang imong temperature kay 36.5. Wipe excess sweat to avoid difficulty in reading the results. Read the temperature reading on the LCD screen display at the eye level. Reading at the eye level ensures contact reading. Record result in the jot-down notebook. Keeps baseline data and to monitor client's progress. Turn off the thermometer and disinfect twice using alcoholized cotton balls from the stem to bulb in a firm twisting motion and store it in a protective case. Cleaning before placing to its container reduces the spread of microorganisms. Record temperature correctly on the graphic chart. Keep baseline data and to monitor client's progress in the future reference. Ma'am, next na tong kuhaon sa imuha kay ang imong oral temperature. Okay lang sa imuha.
Okay.
Wipe the digital thermometer from the bulb towards the stem with a cotton ball with a sterile water, then wipe it with a dry cotton ball. By wiping the digital thermometer in twisting motion from the cleanest to the dirtiest contact with the entire thermometer, thereby minimizing the spread of microorganisms to the cleaner area. Turn on the thermometer on and check for the LCD screen display and ready to use. To check the functionality of the digital thermometer before placing it to the mouth. Instruct client to open mouth, place the thermometer and instruct to close mouth and refrain from talking. To secure thermometer in place.
Ma'am, pwede ka mga kaibsulod na nako ang kuan. Then, close na ma'am.
And leave the thermometer in place until it will emit a sound, meaning result it ready. Allow time based on the manufacturer instruction and recommendation to reach a maximum temperature reading. Remove thermometer from the client's mouth and wipe thermometer using dry tissue paper.
Ma'am, kuhaon na nako ma'am.
Thank you. Wipe excess saliva to avoid difficulty in reading the result. Read the temperature reading on the LCD screen display at the eye level. Read the temperature reading on the LCD screen display at the eye level. Reading at eye level ensure the correct reading. Record result in the jot-down notebook, keeps baseline data, and to monitor client's progress. Turn off the thermometer and disinfect twice using alcoholized cotton ball from the stem to bulb in a firm twisting motion and store it a protective case. Cleaning before placing it to the container reduces the spread of microorganisms. Record temperature correctly on the graphic chart. Keeps baseline data and to monitor client's progress in the future reference. Ma'am, next na kung kaon sa imo ha kay ang imong apical pulse. Okay lang sa imo ha.
Okay.
Wear watch with a second hand or indicator. Position client appropriately. Assist client in a supine or a sitting position. So my client right now is in the sitting position. Place the client's arm next to the body with palm downward or into the abdomen. The position places the radial artery or the inner aspect of the client's wrist or the nurse fingers. Rest over artery and the thumb position to the outer aspect of the client's arm. Place 3 fingers and locate the radial artery. Gently feels the pulse and apply enough pressure, then count for the 1 full minute. Moderate pressure allows the nurse to feel the superficial artery contact with each heartbeat. Record the result in the jot-down notebook and plot the graphic chart. Keeps baseline data and to monitor client's progress. Ensure that the equipment is intact and functioning properly. Checking equipment prior to performing the procedure, avoid erroneous reading, and enable the nurse to save time and energy. Wrap the deflated cuff evenly around the upper arm without contraction. A twisted cuff and wrapping could produce inaccurate. Locate and palpate the brachial artery using with the use of 2 or 3 finger pads. Position the bell of the stethoscope appropriately and cleanse the earpiece with alcoholized cotton balls before placing into the ears. Direct placement of the stethoscope over artery will produce possible around sound transmission. Auscultate the client's blood pressure, pump up the blood until sphygmomanometer reaches to approximate 20 above the point where the systolic blood pressure is noted. Pressure in the cup prevents blood from flowing through the brachial artery. Release the valve gradually and listen for the systolic blood pressure. Systolic pressure in the point at which the blood in the brachial artery is the first able to force its way through against the pressure extent of the vessel by the cuff of the manometer. Continue to deflate the cuff gradually and completely to listen for diastolic pressure. Record the result in the jot-down notebook and plot on the graphic chart. Keeps baseline data and to monitor client's progress. While the client is in supine position, assist in Sims position, and drive for privacy. Proper positioning prevents any injury to occur and facilitates easy and accessibility to the site. And don gloves. To reduce the risk exposure of the body fluids, minimize pathogenic cross-contamination. Prepare the thermometer and lubricate the tip of the rectal thermometer approximately 1 inch above the bulb. Lubrication reduces the friction and irritation of the mucous membrane of the anal canal during insertion. Dominant hand hold the thermometer while the non-dominant hand separate the buttocks to expose anus. Instruct the client to take a deep breath. Taking a deep breath relaxes the sphincter muscles of the anus and rectum, thus having an easy anal insertion. Ma'am, take a deep breath, ma'am. Gently inserts the thermometer to approximately 0 to 1.5 inches. Release the buttocks to allow falling in place. Ma'am, isulod na nako. Leave the thermometer in place until it will emit a sound, meaning the result is ready. Allow time based on the manufacturer's instruction and recommendation to reach a maximum temperature reading. Remove the thermometer and wipe with dry tissue starting from the stem to bulb. Discard used tissue in the waste receptacle. Ma'am, tanggalo na nako. Phases of the thermometer may allow difficulty or reading the results. Remove the thermometer and wipe with the dry tissue starting from the stem to bulb. Discard used tissue in the waste receptacle. Phases of the thermometer may allow difficulty or reading the results. Feed the temperature reading on the LCD screen display at eye level. Reading at eye level ensure correct reading. Wipe the anal area with tissue and cover client for privacy. Immediately discard used tissue in the waste receptacle. Clean the anal area to help prevent the spread of microorganisms. Record result in the jot-down notebook. Keep baseline data and to monitor client's progress. Turn off the thermometer and disinfect twice using alcoholized cotton ball from the stem to bulb in a firm twisting motion and store it in a protective cases. Cleaning before placing to its container reduces spread of microorganisms. Dispose used gloves help prevent spread of microorganisms.